Hello there. My name is Brien. I'm the founder of Wellness Movement Services. Thank you so much for clicking on this link. And now you're going to learn what makes us unique. And the first thing is that I choose to listen. One of the weakest links in the healthcare industry is that nobody's really listening to their patients or clients. Nobody's taking the time, and the patient is feeling like they're rushed through and they're not being heard. So listening is really important. That's the first thing that makes me unique, or what we do here at Wellness Movement Services. But in a consultation process, I embrace the Socratic method. The Socratic method is based off of the question. It's the type of questions that we're asking. But by gathering the information from my clients and asking them the right questions, on determining what and where this whole thing is coming from. Because what I want to focus on is the cause to your wellness and movement concerns. And this is done through my wellness movement lifestyle consultations. Now, I have two consultations that I can offer. I offer a basic consultation and a comprehensive. What's the difference? Well, both of them are going to ask questions that have to do with my four principles to wellness and movement. So in these questionnaires, I'm asking them about each one of the principles. And in the survey, I'm only asking a few questions for each one of the principles. But in the comprehensive version, I'm asking a lot more, going a lot deeper, because the deeper I can go, the more I can understand what's going on. In fact, I was at a workshop once, and the instructor said something very unique. He said, the mystery is in the history. And what he was referring to was the health history. And I'll go a step further, that the mystery is not only in the health history, but it's in the details to that person's lifestyle history. The mystery is in the history. So yes, I ask a lot of questions, or I have a questionnaire, a health history form that someone fills out. And there are a lot of questions on there. But then you get into the basic or comprehensive questionnaire, and there we go a lot deeper, leaving no stone unturned. And in interviewing hundreds and hundreds of clients, the one thing I often hear is that nobody listens, Brien. Nobody takes the time. My consultations are sometimes an hour and a half, 2 hours. And one of the things that I ask them is, how many different practitioners have you been to? And sometimes they'll say, well, I've been to one or two, or they may say three or four, or maybe sometimes five or six. And in a period of time, granted, it might be over a 10-year period of time, it might be over a 5-year period of time. If it's shorter than that, then but the point is, in that period of time, a lot of them did get temporary relief, because the practitioner was focusing just on the symptom. Now, I will say that we want to take care of the symptom up front, but I take a holistic and integrative approach. I don't do it alone. I have a team of experts that I can refer out to. I was told, and I'm taught, when in doubt, refer out. But the point I'm trying to make is, all these different practitioners and all this time and all this money, my clients have invested hundreds and hundreds, if not thousands of dollars. I take all that into consideration. And once I refer them over, this is the other weak link in healthcare, is to communicate with that practitioner. What we can do is, we together can enhance that patient's wellness and movement. But communicating so that the right hand knows what the left hand is doing. So a lot of times, I've had to refer out to a chiropractor, let's say. Now, I spent 7 years working next to a functional nutritionist. He was a functional neurologist, and he was a chiropractor. And I would refer my clients to him after they've went through my consultation process, and or if they went through my physical assessment process, for further evaluation and recommendations. And that chiropractor would either email me or call me and let me know what his findings are, and also suggest what I should do. Because I want to make sure that whatever I am doing is not interrupting what that client really needs. So if I'm providing them with an exercise and it is making them worse because I am not taking into consideration what the chiropractor is doing, let alone the massage therapist or even a physical therapist. I've had people, come out of physical therapy and come right into my practice as a post-rehab function. But I can communicate with that physical therapist or that doctor, chiropractor, or the doctor. I have worked with doctors before as well, or the massage therapist, and understand what my role is. What am I going to provide them that'll work in concert to what these other practitioners are providing for our patient? Because my clients come to me through referrals 98% of the time. I barely get any walk-ins or cold calls. My clients will get referred to me from practitioners and family members. The practitioners maybe that are associated to my outsourced referral team. Or my clients referring, a family member or a friend saying, hey, you have to go talk to Brien because if anybody can figure this out, he can. So by time they make the call, they're already vetted. And the other thing I always like my clients and my practitioners know is that if you're going to send me somebody, refer someone to me, let them know that they need to participate and take responsibility in this. And most importantly, they have to want to get well. Now, really, to make this as easy as possible, I've created a 5-step process. Because again, we go back to the analogy, you can give a man a fish, feed him for a day, or you can teach a man to fish and feed him for a lifetime. I want to not just give my clients something that'll help them short term, but what I would love to do is teach them how to follow their own wellness plan, and whether it be a corrective exercise system, or a general exercise system, or if they're an athlete, a strength and conditioning training system that they can follow on their own eventually. I'm teaching them through different levels to get to their dream, their, if you want to call it, their long-term goal, whatever their vision is. And I'm going to ask you right now, if you're listening to this, what is your wellness and movement dream? What would you like to be able to do that you can't now? And that is going to be the anchor. And then we'll set up small intentions weekly or monthly to get you to your dream. But we make that intention after we have established what it is that we want to accomplish. 5 steps towards enhanced wellness and movement. I have worked on this and honed this idea for over 15 years. The litmus test was done really between 2010 and about 2016. So the step-by-step process. Step 1, wellness and movement lifestyle basic and comprehensive consultation, which is the purpose of this video. And once I've subjectively gathered that information, now I have a better idea what I'm dealing with. Because a person comes to me and they get referred to me, and let's say they have pain, or they want to increase their athletic performance and they're plateauing and they're running slower, or let's say someone has some movement restrictions. All this to say, why am I looking at lifestyle factors? Because lifestyle factors play an important role in correcting the imbalance. Now, the one thing I will say, if you don't have pain, all right, and you just want to lose weight and get into shape and get stronger, or maybe you want to run an event, 5K or whatever it is, I'm going to share with you something that a lot of people aren't familiar with, because my job is to prevent further challenges. And if you look at the 10 musculoskeletal health risk factors, look at the first 2. If you've had a previous injury or you have imbalances, you're already at risk. But look at number 6. This one was recently added within the last decade. Now they're saying, with proof and evidence, that lifestyle risk factors have an effect on movement potential. So even in the highest levels of sports, athletic trainers, physical therapists, orthopedics, strength and conditioning coaches, and such, they are now asking more questions that have to do with lifestyle, which is why I created the 4 principles to wellness and movement. Each principle is integrated with the other. In the center of my logo is a small image of the human anatomy. As the colors intersect with the human anatomy image, that is showing you that it's all interrelated. If I take it one step further, our body is a cybernetic system of systems. We have 10 systems within this human body, cybernetic body. And like a computer, all systems, all operating systems talk to one another. That's why I'm integrating and using my Zoom with my PowerPoint within my Mac computer. It's a system of systems. It can think, it can integrate. So it's a thinking machine because I can type words into it or talk words into it. It can integrate, meaning that I can be on my PowerPoint while I'm in Zoom. Well, that's the same thing with the body. If we're not looking at the body as a whole and we're only looking at it at the sum of its parts, then we're only going to get partial results. That goes back to the old adage of treating the symptom. And in true holistic and integrative medicine or healthcare, this is how we view it. Taking an authentic approach with high integrity and credibility, and understanding that, yes, your lack of ability to handle your emotional stress is affecting your sleep and affecting your gut. Your inability to sleep through the night will affect your repair and your rejuvenation, as shown here in this image, that between 10 p.m. and 2 a.m. is when your body goes into physical repair. And between 2 a.m. and 6 a.m. is when your body goes into psychological repair. And in this nice sleep-wake cycle, we're in a healthy rhythm hormonally, which is going to bring you an anabolic response at the end of the day. Anabolic means to build up, whereas the majority of the people that I consult with, their 4 principles are out of balance and they're living highly in stress and they're not sleeping when they should be to repair and replenish the body. But movement being the 4th principle, as an ex-personal trainer, now I coach people and teach them how to exercise. I don't really call myself a personal trainer any longer, but they usually come to me with a movement-based question. I want to run faster. I want to, lift stronger, or I have restrictions in my hip, or I just got done doing 9 weeks of physical therapy and I want to get my back better, my shoulder better. And let's stop there for a second. My clients come to me and they say, well, I have a back problem, shoulder problem, neck problem. We're going to throw out that word problem, number 1. So any challenge to one joint, let's say for instance a shoulder joint, I will say, oh, you have a shoulder challenge. But really what you have is a body challenge, because the shoulder is interconnected to all the muscles throughout the trunk, as you can see here. You look at the back part of the shoulder, and that's integrated with the middle of the back all the way down to the glutes. And in the front of their body, where their shoulders are, that's integrated into their chest, their middle of their core, down to their hips, all the way down into their thigh. And that's just the musculoskeletal system. If we wanted to go deeper than this and look at things like digestion, as an example. And because I am holistic, I do understand the acupuncture meridian lines. I understand what they do. I know where they're located, but I'm not an acupuncturist. What I'm getting to here is that these other areas need to be addressed along with the physical part. But here's my point. Each principle integrates with the other. Now, let me come back here to movement. So I want to move better. All right. I want you to move better. But the physical part is actually not the most difficult. Not for me, anyway. The difficulty in restoring movement lies in, does it have to do with their sleep? Does it have to do with their emotion? Does it have to do with how they're digesting, what they're eating, when they're eating, or drinking? That's where we get to the cause. Let's say, for example, like pain. So my clients that have chronic pain, joint pain, inflammation, I will suggest that they take all sugar out of their eating plan, all starchy grains and dark shade vegetables, because these things are pro-inflammatory. Oh, in all alcohol, these are all pro-inflammatory. See, it's a different way of looking at pain. And again, we go back to the whole, 90% of what we're dealing with here has to do with some sort of stress on the body, not just emotional stress. I get that. Emotional stress can definitely increase our inflammatory hormones. But what we're also talking about here, if I eat the wrong foods, which I have to be very careful of now, it can activate a stress response in my digestion, which in turn will affect my muscle function. And principle one, when I gather the information based on what is stressing them right now in their life. In fact, if I asked you right here, what are the 5 biggest stressors in your life? Now, I'm not a psychologist or an emotional health coach. I have those people I can refer out to. And my clients don't have to give me any details. But by me knowing where those markers were in their life, that starts to draw a timeline, because emotions get stored, negative or positive, get stored in the body. And principle 2, of course, I just covered a little bit of how important sleep is. Nutrition, yes, emotional stress can contribute to digestive disturbances like irritable bowel syndrome and vice versa. We have a second brain in the gut. The gut is a thinking organ. So if you're holding on to stress, there's 2 types of stress. In this case, there are hundreds of different stressors on the body. But there's 2 types of stress. There's acute stress, and then there's chronic, or what I call stealth stress. You follow me? So stealth stress is something that is deep inside, that is kind of nagging at you. And the acute stress, well, that's if you walk out of your house and you find out you have 3 flat tires and you're already late for work. And there are many stressors on the body. Heat is a stressor on the body. There's electromagnetic stress on the body. There's physical stress from poor posture or muscle imbalances. There's mental emotional stress, depression, and PTSD, etc. So there are many things that stress the body, and what I'm doing is I'm eliminating the weak links. And by getting your mind right, which is where it all starts, the weakest muscle in the body is the mind. By helping us to think differently and change our perception, and we can do this through mind training, or I can refer you out to someone that can really help you with some of the past traumas, like I went through, the past traumas from your life. Now our minds are then working better, so that when stress continues to happen, which is going to, I've often had people tell me, hey, I'm not going to be able to decrease all the stress in my life. I said, well, the outside stress you may not have control over. Some you do, but most of the time you don't, because who knows? You wake up one morning, like I said, you go outside, you got 3 flat tires and you're already late for work. But what we can change is how we perceive it. And then we can handle it better. So in other words, when we have emotional stress, that's resistance. When we learn how to manage our mind, then that resistance doesn't have the same effect on you. And then lastly, how are we moving? How are we moving individually? We should be looking and rating and ranking all of these, which is what I do. I rate and rank all of this on a continuum. Where are you? See what the differences are. So in the before box here, we have an overall score of 215 out of 494. This is an algorithm that was created for me based off of my comprehensive questionnaire, not my basic. And here under emotional health, based on how they answered the questions, here they are at a 45 out of 50. So that is the marker. And then we have biochemical health, nutritional health, and physical health, and then the total score was 215. Now, after they started to implement their wellness plan to correct, or I've referred them out for areas that went outside my scope of practice, you can see here that their numbers came down. And if we are teachers, then they will have the tools to maintain that. Yeah, they can come back for tune-ups to me, but my clients have learned to manage their own wellness and movement. They've learned to do that. They've brought their score down. And going back to the before, the 215, the higher scores, what we're looking at is the higher the score, so they got a 215, the lower their readiness is for exercise because that person, whether they're in pain or not, they want to get going, but they're not ready. Their body is not ready because the load is too high. Each one of these principles, we have a 45, 31, these are all individual loads on the nervous system. The nervous system and the hormonal system are the two chief operating systems of the entire body, going back to the cybernetics organism, a system of systems. And we know that exercise, not all exercise, but most exercise is going to stimulate your nervous system. So for my clients who have a high rating and a low readiness for exercise, I will suggest exercise like medicine at this point because what it is. Exercise is medicine. There are a variety of exercises that I cultivate and use that don't overstimulate the nervous or hormonal systems. The nervous system and the hormonal system are the two chief operating systems. And someone had said to me once, I thought the immune system was one of the most important, and it is, but your immune system is a circulating nervous system. So yes, your immune system is at the top because your immune system is a floating nervous system. But the hormonal and nervous system are the two chief operating systems of the body. And exercise being like a medicine, we can prescribe exercises that won't overstimulate the nervous system. So you see how important it is. And all we're talking about here is the consultation process, is uncovering the mystery and the history. In closing, these two images will help for you to see what I do in that process as I sit there and consult with the client. Now, but that's what makes what I do unique. It all comes down to listening and paying attention to the details. I want to thank you for listening to this little presentation. And if you would like to get started on your journey towards wellness and movement, the contact information will follow this short video. Have yourself a great day. Be well, and bye for now.